Matt Tilley and Jane Hall for breakfast. Podcasting now.
Kiss.
This is something that this was the premise of this show.
Yep.
That we're all basically at war with our bodies, whether it's because we're trying to stop aging, putting on weight, looking how we don't want to look,
Make
hating
our brain
nose,
work
whatever.
a certain way.
And I feel like that's the human condition to
Yep.
an extent, but then there's a point at which it goes beyond that, and the word we generally throw around there is body dysmorphia. Where people go, oh my God, I'm so fat, and everyone looks and goes, you're so skinny.
Yeah, but is that it? So here to tell us all about it is Dr. Ben Buchanan. Thank you very much for your time, Dr. Ben.
It's a pleasure.
Now, I believe the correct terminology is actually body dysmorphic disorder. Is that right?
Yeah, body dysmorphic disorder or body dysmorphia.
Okay, so you, in a nutshell, explain to us what it is in layman's terms.
Yeah, so body dysmorphia is a mental disorder where people are really concerned with the way they look. But this isn't just normal body image concern that we all experience. This is when someone might spend like 8 hours a day in the mirror checking their appearance to make sure that they're looking okay. And it can really affect their lives, from their social life. Maybe they don't go to work because they're concerned that they don't look quite right.
Right.
And the important thing is that people with body dysmorphia, they look normal. That some of them
they're functioning.
Yeah, they look normal, but they just feel that they look incredibly ugly.
Right.
Okay.
In my mind, you've described Kim Kardashian, a lot of those symptoms there. But I guess that the thing that's interesting for anybody listening now is where is the line? Like, for example, I think it's funny that everyone has a pose. When you get up in the morning, you stand in front of the mirror, right? Beyond checking that you're awake, you probably tilt your head a certain way, twist a certain way, and that's the way you look at yourself every day, because I guess somehow it's infected your brain that's the best sort of angle.
Yeah.
So that's normal, right?
I suppose the line that gets drawn between normal body image concerns and body dysmorphia is the amount of time that someone spends in front of the mirror or thinking about it.
Does someone who has body dysmorphia, their first port of call is often somewhere like a plastic surgeon instead of a counsellor? So they'll see the imperfection and go to correct it rather than to understand their condition.
Because they're so desperate, right? They're really desperate to find a fix, a solution to their distress. They might be after a boob job or a nose job or fixing skin imperfections.
It's really not the problem, is it?
It's not the problem. And what we know is that if you've got body dysmorphia and you get corrected or you get surgery of some kind, you're not going to be satisfied with it. The research shows that 84% of people with body dysmorphia who get surgery aren't satisfied.
So I'm listening now to what you're saying, and I'm wondering, where's the line drawn before I go, I'm vain? No, I've got dysmorphia. For example, I'm uncomfortable with having a hairy back. It's what God's given me, so I should just deal with it. But then if I went and got laser surgery to have it all fixed, is that vanity or is that a touch of dysmorphia?
An important thing is, if someone's having the thought that cosmetic surgery will be a revolution to their life, that it will fix every single problem, it will fix their problems in relationships, it will make them their career go further.
Confidence.
Then that's a warning sign that they're overvaluing what cosmetic surgery might provide.
Right.
You don't think getting rid of the hair on your back's going to make you more interesting or fabulous,
Well,
do
I'm
you?
not sure outside NASA there's a laser powerful enough. That's
I don't
my
think there is
reason.
either. That's the problem.
No, I was using that as an example. It's just something where you go, we all hate something about ourselves, but if there was a magic wand, we'd change it.
But you're talking about it, right? I mean, if you had body dysmorphia, you wouldn't be talking about it. You'd be intensely shameful about it and wouldn't be speaking about it on air.
Well, I'm a bit of an extrovert, though. It's kind of my job. But, it doesn't mean I don't have my private tears.
Yeah.
Oh, please, let me get the world's tiniest violin out for Mr. Hairy Back.
Well, look, I am a psychologist, so if you'd like some counselling.
I'm okay. It's just been fascinating because I think everybody in your dark moments, you wonder, do I have a problem here or am I just a human being who's naturally got insecurities?
Finally, Dr. Ben, can you cure it?
Yeah, so we know that the best treatment for body dysmorphia is counselling. And is speaking to someone about it. Often people with body dysmorphia can be distressed for decades or years about how they don't like the way they look. And so we know that counselling can undo this, but it takes time.
Sure.
And so really speaking about it, identifying that, hey, this is a mental problem, not a physical one.
Right.
And then speaking about it is the best protocol.
Dr. Ben, thank you very much for your information. It's fascinating stuff.
It's a pleasure.
Turn it up. Matt Tilley and Jane Hall for breakfast. Podcasting now.